Welcome to another PRReach.com video news release. In today's news, Zofran lawsuits seek damages for 12 birth defects. 4 families have brought civil lawsuits against GlaxoSmithKline, the pharmaceutical conglomerate and manufacturer of anti-nausea drug Zofran. In their complaints, plaintiffs allege that Zofran, approved only to treat severe nausea and vomiting in patients receiving cancer treatments and surgical anesthesia, was fraudulently promoted as a safe and effective treatment for morning sickness. After being prescribed Zofran for morning sickness during early pregnancy, each mother claims delivering a child with birth defects. Independently, 4 major studies have found an increased incidence of congenital abnormalities among children born to women who took Zofran as a morning sickness treatment. Court documents now allege that GlaxoSmithKline was aware of Zofran's potential risks, but failed to warn the public or health community. In docket 115 CV-10429, a mother from Massachusetts claims that after being prescribed Zofran for morning sickness, her child was born with numerous congenital defects, including 3 congenital heart defects: atrial septal defect, a hole between heart chambers that prevents blood from adequately nourishing the body; right ventricular hypertension, a high blood pressure in arteries throughout the lungs; an aortic arch hypoplasia, an abnormal blockage of the artery that carries blood toward the body. The plaintiff also alleges that her child was diagnosed with webbed toes, sensitivity to light, hearing loss, and low-set ears. Diagnoses of inguinal hernia, in which contents of the abdominal cavity protrude further than normal, and what court documents call facial dysmorphia, were also made. The plaintiff claims that her daughter has undergone 10 separate surgical procedures and suffers substantial developmental delays as a result of her congenital defects. In docket 215-CV-00709PD, a mother from Minnesota claims that her 2 daughters were both born prematurely after being exposed to Zofran during the first trimester. Both children were diagnosed with congenital heart defects shortly after birth and have suffered developmental delays. Docket R615761042, filed by a mother from Oakland, California, claims that the plaintiff's child was born with supraventricular tachycardia, an abnormally fast heartbeat caused by improper electrical signaling, after plaintiff was prescribed Zofran during the first trimester. In the most recent lawsuit filed under docket number CGC-15-544524, parents from San Francisco allege that their child was born with bicuspid aortic stenosis as a result of Zofran exposure. In this defect of the heart, a valve that allows blood to flow from the heart to the body is closed by only 2 flaps rather than the 3 seen in normal heart valves. If the allegations in these new lawsuits prove true, any mother who is prescribed Zofran as a morning sickness treatment during early pregnancy and then delivered a child with birth defects may be entitled to pursue a claim for compensation against GlaxoSmithKline. Families interested in learning more are urged to contact Monheit Law, a firm currently investigating claims against GlaxoSmithKline, along with the National Alliance of Distinguished Plaintiffs' Attorneys. For more information, visit the link below. And to learn more about this video news release, visit PRReach.com.